What if the greatest danger to your life was something you couldn't see, feel, or sense until it was too late? The terrifying reality is that clogged arteries can silently put your heart at risk, even if you feel perfectly fine. Many people never realize they have a problem until a devastating heart attack or stroke strikes, changing their lives forever. Artery blockages, primarily caused by a condition called atherosclerosis, occur when plaque, a sticky mixture of fat, cholesterol, calcium, and other substances, gradually builds up inside blood vessels. This narrows the arteries, restricting blood flow and increasing the risk of life-threatening events. The key to prevention is awareness. In this guide, we will uncover 9 critical warning signs that may indicate artery blockages, helping you take proactive steps toward better heart health before it's too late. 1. Chest pain or discomfort, angina. A warning sign. You shouldn't ignore chest pain is one of the most recognized signs of artery blockages, yet it often goes unnoticed or is mistaken for indigestion or muscle strain. Angina occurs when the heart doesn't receive enough oxygen-rich blood, signaling an underlying issue with circulation. What it feels like. Angina typically presents as a sensation of tightness, pressure, or burning in the chest. The discomfort may extend to the arms, jaw, neck, or back, making it easy to misinterpret. When it occurs, this type of chest pain is often triggered by physical exertion or emotional stress and tends to subside with rest. If symptoms persist despite stopping activity, it may indicate a more serious problem. Why it happens. Blocked or narrowed arteries restrict blood flow to the heart, depriving it of oxygen. This lack of oxygen causes discomfort, which should be taken seriously as a potential precursor to a heart attack. What to do? If you experience persistent or recurring chest discomfort, especially during activity, seek immediate medical attention. Early intervention can prevent complications and significantly improve heart health too. Shortness of breath, a silent warning sign. Difficulty breathing can be an early indication that your heart is struggling to circulate blood effectively due to blocked arteries. Why it happens. When blood flow to the heart is restricted, the heart must work harder to pump oxygen-rich blood throughout the body. This added strain can lead to reduced oxygen levels in the lungs, making it difficult to breathe. When to be concerned. If you experience breathlessness after light activities such as walking short distances or climbing stairs, it may be a sign of an underlying heart condition that requires attention. A critical warning. If shortness of breath occurs even when you are at rest or lying down, it could indicate a more severe cardiac issue. In such cases, immediate medical evaluation is essential to prevent potential complications. 3. Unexplained fatigue. Do you often feel exhausted despite getting enough rest? Unexplained, ongoing fatigue could indicate that your heart is working harder than normal to compensate for restricted blood flow. Why it matters. When your heart struggles to pump efficiently, oxygen supply to your muscles and organs decreases. As a result, your body conserves energy, making even everyday activities feel draining. Who's at risk? Women, in particular, are more likely to experience fatigue as an early symptom of heart disease rather than the typical chest pain often associated with heart issues. This can lead to delayed diagnosis and treatment. When to seek help. If you notice a sudden drop in energy levels without an obvious cause, don't ignore it. Persistent fatigue, especially when paired with other symptoms like shortness of breath or dizziness, warrants a checkup with a healthcare professional. Early detection of heart problems can prevent serious complications. Leg pain or cramps, peripheral artery disease (PAD). Experiencing pain or cramps in your legs while walking or exercising could be a warning sign of peripheral artery disease (PAD). a condition caused by narrowed or blocked arteries in the lower body. How it happens. When arteries become clogged with plaque, blood flow to the leg muscles is restricted, leading to discomfort, cramping, or a heavy sensation. Common locations. The pain typically affects the calves, thighs, or buttocks. It often worsens with physical activity and improves with rest. Why it's serious. PAD is not just a leg problem. It's a sign of systemic atherosclerosis, meaning the arteries throughout the body are affected. This significantly increases the risk of heart attacks and strokes. If you notice persistent leg pain or cramping, especially during movement, it's crucial to consult a healthcare professional. Early detection and treatment can help manage symptoms and reduce the risk of severe complications. 5. Nausea and excessive sweating. Experiencing sudden nausea or breaking into a cold sweat without exertion? These could be subtle, but serious signs of a heart problem. What's happening inside your body? When the heart struggles to function properly, it can activate the autonomic nervous system, leading to symptoms that mimic a panic attack, such as nausea and excessive sweating. Why is this dangerous? These symptoms are commonly associated with heart attacks. Ignoring them, especially if accompanied by chest pain or discomfort, can be life-threatening. Key takeaway: if you experience sudden, unexplained nausea and sweating, don't dismiss it. Seek medical attention immediately. It could be your body's way of signaling a cardiac emergency. 6. Heart palpitations. Experiencing a racing or irregular heartbeat can be a warning sign that your heart is struggling due to blocked arteries. Potential causes. When arteries are narrowed, blood flow to the heart is restricted. To compensate, the heart beats faster or irregularly, resulting in noticeable palpitations. When to be concerned. Occasional palpitations may not be alarming, but if they are accompanied by dizziness, chest pain, or fainting, they could indicate a more serious cardiovascular condition requiring immediate attention. Next steps. If you frequently experience palpitations, it's essential to monitor your heart rhythm. Keep track of when and how often they occur and seek medical advice. A doctor may recommend tests such as an electrocardiogram, ECG, or a heart monitor to assess your condition. Heart palpitations can stem from various factors, including stress, caffeine, or dehydration, but they should never be ignored, especially if they persist or worsen. Paying attention to your heart signals and consulting a healthcare professional can help detect and prevent potential heart issues early. 7. High blood pressure, hypertension. Often referred to as the silent killer, hypertension typically presents no symptoms, but can quietly inflict serious damage on the arteries over time. How it leads to blockages. Persistent high pressure weakens artery walls, making them more susceptible to plaque accumulation, which narrows the arteries and restricts blood flow. Severe complications. If left unmanaged, hypertension significantly raises the risk of life-threatening conditions such as heart attacks, strokes, and aneurysms. Prevention and management. Regular blood pressure monitoring is crucial. Adopting a heart-healthy lifestyle, reducing sodium intake, maintaining a balanced diet, exercising regularly, and managing stress can help control blood pressure and lower the risk of complications. 8. Swelling in the legs or feet, edema. Swelling in the lower extremities, known as edema, may be a sign of fluid retention caused by poor circulation. This can result from artery blockages or heart dysfunction, preventing the heart from effectively pumping blood throughout the body. Why it happens. When the heart struggles to circulate blood properly, excess fluid builds up in the legs and feet, leading to noticeable swelling. This is often a sign of an underlying cardiovascular issue. Signs to watch for edema typically worsens as the day progresses, causing discomfort, tightness, or a heavy sensation in the affected areas. In some cases, pressing on the swollen area may leave a temporary indentation. When to seek medical attention? Sudden swelling, especially if accompanied by symptoms such as fatigue, shortness of breath, chest pain, or rapid weight gain, may indicate a serious condition requiring immediate medical evaluation. If you notice persistent or worsening swelling, consult a healthcare professional to determine the underlying cause and receive appropriate treatment. Monitoring leg and foot swelling is essential, as it can be an early warning sign of heart disease or other circulatory issues. Taking timely action can help prevent complications and improve overall heart health. 9. Cold, discolored skin in extremities. Poor circulation caused by arterial blockages can significantly affect the temperature and color of the skin, particularly in the hands and feet. When blood flow is restricted, these areas may not receive adequate oxygen and nutrients, leading to noticeable changes. What to look for? If your extremities appear pale, bluish, or feel unusually cold to the touch, it may be a sign of compromised circulation. Why it matters? Healthy blood flow is essential for delivering oxygen and vital nutrients to tissues. When circulation is impaired, cells struggle to function properly, increasing the risk of further complications. Serious implications. Persistent coldness or discoloration in the hands and feet could indicate peripheral artery disease, PAD, or advanced atherosclerosis, conditions that restrict blood flow due to narrowed or hardened arteries. Left untreated, these conditions may lead to severe complications, including ulcers, infections, or even tissue death. If you notice these symptoms, consult a healthcare professional promptly. Early detection and intervention can prevent further progression and improve overall vascular health. Your heart is at the core of your well-being, and protecting it should be a top priority. Here's what you need to remember. 1. Early detection saves lives. Pay attention to warning signs like chest pain, shortness of breath, and unusual fatigue. Ignoring them could be dangerous. 2. Small changes lead to big results. Adopting a heart-healthy diet, staying active, and managing stress can significantly lower your risk of cardiovascular disease. 3. Routine checkups are essential. Many heart conditions develop silently, so regular screenings for blood pressure, cholesterol, and heart function can catch problems early. 4. Don't hesitate to seek medical help. If you notice any concerning symptoms, consult a healthcare professional without delay. Your heart's health depends on it. Your heart works tirelessly for you every second of the day. Give it the care it deserves now so it can keep you strong and thriving for years to come. A healthier heart means a longer, fuller life. Start making choices today that your future self will thank you for.